From our 22 News Broadcast Center, this is 22 News in Focus.
Good Sunday afternoon. Welcome to 22 News in Focus. I'm Ashley Afonso. October is Breast Cancer Awareness Month, an annual campaign to increase awareness of the disease that of nearly 1 in 8 women will develop in their lifetime. The American Cancer Society estimates that in the United States in 2018, over 260,000 new cases of invasive breast cancer will be diagnosed in women. Some 40,000 women will die from breast cancer. Today on 22 News in Focus, we'll be discussing the prevention, diagnosis, and treatment of this disease and ways you can help and provide support. Joining me now are Dr. Grace McCary-Judson, chair of the Bay State Health Breast Network. We also have Denise Jordan, chair of the 25th anniversary for Rays of Hope Walk and Run toward the cure for breast cancer, and Lucy Giugio Carvalho, founder of the Rays of Hope Walk and Run. Thank you all for being here with us today.
Thanks for having us.
So first of all, tell me a little bit about what is Bay State's Breast and Wellness Center.
Bay State has an integrated program that coordinates care not just at Bay State Medical Center but throughout the Bay State sites. What we do is we are sure that we have integrated, coordinated care with multidisciplinary teams. The Bay State Breast and Wellness Center is where imaging and breast surgery goes on. The D'Amour Center for Cancer Care is where radiation, chemotherapy, and other treatments occur. And we work at a team. We also include our partners in Franklin, Mary Lane, Wing, Noble Hospital. All of these groups look at the Bay State Health Breast Network for guidelines so that we can all be assured that patients are receiving evidence-based, guideline-driven care.
Okay, so the Rays of Hope works directly with Bay State. How did this come to be, and how did you become affiliated with Bay State?
Well, I worked at Bay State at the time. I worked on the oncology unit, and I was 38 and had breast cancer, was diagnosed with breast cancer, and I found it really hard to figure out how to, manage the healthcare system, and I thought, wow, I'm a nurse and I'm having a really hard time. So I thought we really needed to have a walk or something that we could raise money for breast cancer services in Western Mass and have the money stay locally.
Okay, and Denise, how did you become involved with the organization?
So I had been a member of the Rays of Hope Advisory Board since 2008. And so I was a part of the process in terms of trying to think of some of the community organizations and the resources that would work with survivors and their families. And then I was diagnosed in 2014. So I was brought to Rays of Hope by my friend, the late Tracy Benton Whitley, who was also a member of the Rays of Hope Advisory Board. So that's how I became a part of the Rays of Hope family.
So that's a little bit of a different story. You were already involved in this organization beforehand. So how did that change your path to treatment and knowledge? Did you feel like you had a lot more knowledge going into treatment?
Absolutely. I think because I did have firsthand knowledge, I wasn't afraid. I knew so many survivors. I know folks that had benefited from being treated at Bay State and were a part of the Rays of Hope, the aftercare. And although they provide care before, during, and after treatment. So I kind of went into it with a lot more information than probably the average person, but having that knowledge was helpful and beneficial to me. But then I could also come out on the other side to say, you know what, this organization, what they're putting out in the community, it works.
And Doctor, what have you been able to see? How much has it helped your organization?
It's incredible. It's been 25 years now. This is the 25th walk. And Rays of Hope has helped Bay State, and I would say there are 3 themes that I would really like to emphasize. The first is helping to develop coordinated, sophisticated care and really to help cultivate expertise in breast care. The second is providing extras, some of the resources and outreach and additional support services with our community partners. And then the third is research and helping to support research, not just in terms of research that's available nationally, but really to develop research here in the Pioneer Valley with a partnership that we have with the Rays of Hope Center for Breast Cancer Research.
Okay, what kinds of technology, what kind of advancements in technology have there been lately?
Rays of Hope has been supportive of us really bringing in new technologies to the Pioneer Valley. So for example, a big focus of breast cancer care is less invasive care, but yet still getting the same excellent outcomes. So less invasive means less invasive breast biopsy, less invasive surgery, less radiation, and trying to omit chemotherapy when appropriate. There are a couple of things I'd love to highlight that Rays of Hope has supported us with, and one is many years ago, in fact in the late 1990s, we were able to get funding for Sentinel node biopsy technology, which was a really important step in minimizing surgery under the arm of new breast cancer patients. And we were the first in the region to be able to do that thanks to the support from Rays of Hope. Another example is the radioactive seed localization, which is a less invasive way that breast surgeons can remove an area in the breast that they can't feel. And again, that's a technology that was supported by Rays of Hope. Dr. Holly Mason is the one that helped to really move this forward, and we're the only ones in Western Mass that can provide that type of breast surgery.
Lucy, when you see the change in treatment since you underwent breast cancer treatment, what do you think?
Back, 25 years ago, it still was even not talked about. I mean, that's how different it is now. And I think they're just, in the beginning we focused on education because there was a lot of need for education and increasing awareness, whereas now it's all shifted to research and advancing, how we do breast cancer treatment at Bay State Medical Center and how to do it better, and still, still having that support around us, for services and just all kinds of services and treatments and fun things like Reiki and massage and art therapy, art from the heart. We do a lot with that. It's just an incredible resource. In the beginning, I didn't see a lot of services. In fact, there wasn't even a coordinated care center. And that was like I think if I had a vision at that point, that's what the vision was, to have everything in one place where people could go and get all the things that they need. And that's what we have now. So I think it's, the walk worked. And it really, really has made an incredible difference in what people get in Western Mass as far as services and treatment.
This would be a question for both you and Denise. Now that you have gone through breast cancer and been part of this organization, have you been surprised by how many women are also fighting this battle? I mean, we said 1 in 8 women in the United States.
Yes. I'm surprised. When I was undergoing my treatment, my coworker in my office was diagnosed. So we basically went through some of the journey together. I had a little bit more treatment than she did, but we were already close, but we got a lot closer. And I speak a lot about the fact that there's like a kinship amongst survivors.
There is.
And that when someone finds out that you are a breast cancer survivor, you have just an automatic bond. And so many women that haven't shared their experience, when they know that you have had that experience, then they feel more comfortable saying to you, like, I had breast cancer as well, and it's just good to see folks that have made it on the other side.
It's interesting, at our breast cancer survivorship functions, we've done some surveys, and one of the questions was, what's important to you? And the number one answer was belonging to a community like Rays of Hope. So people really do think about Rays of Hope. We have a newsletter that goes out to, I think, 22,000, and that Rays of Hope newsletter is the #1 source, not to say anything about television, but it's the, but again, when we surveyed our survivors, they said it was their most reliable source of information about what's new in the world of breast cancer.
Okay, and when a woman is diagnosed with breast cancer and she comes to you guys, what's the first step you'll walk her through?
Emotionally, I think, is the piece that I try to address. Just, how they feel about what's going on in their lives right then and there, and kind of connecting them to the right resource. I think that that's important, and that there's other people in the same boat, and that we will be there together, and we will figure this out. And
all right. This year marks a special anniversary for Bay State's breast cancer fundraiser. We'll learn more after the break. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're talking about screening, diagnosis, and treatment for breast cancer during Breast Cancer Awareness Month. This year marks the 25th anniversary of the Rays of Hope Walk and Run toward the cure of breast cancer. So let's talk a little bit about education. I know your main focus, as you mentioned earlier, is on research now, but when we talk about prevention and mammography, what are you telling women? What is the message you're trying to get out there?
I think the main message is to make sure you schedule a mammography. It's very important. For me personally, when I was having my mammogram, the size was so small, but the technician was diligent to keep checking and checking and checking. So early detection is key. And so it's really important. Can't stress it enough.
And it seems like even within the last decade or so, breast cancer has been detected a lot earlier in a lot of women than maybe it would have beforehand.
Well, I think the terrific news since the 1990s when the walk was started is that thanks to early detection and better treatments, they go together, that the likelihood of dying from breast cancer has decreased 39%. So if we look at someone that's newly diagnosed today, the 5-year survival is 91%.
So let's talk a little bit about the walk. 25 years. What's so special, and what are you doing this year to celebrate the 25th anniversary?
Well, I've always been told that I like a lot of hoopla. and really, I think we try to make the walk exciting, but this year we've kind of gone to another level. This year is going to be a great walk. We have educational booths. We have the Pink Hope Lounge. We've kind of mixed up the program for the day. It's just a wonderful, uplifting event that I can't even explain in words. You kind of have to go. And you have to be there. There's like a spirit that it feels like one big hug, you know, is around every breast cancer survivor and their families. And it's just an amazing experience. And I'm just always amazed, you know, and I think of all the walkers as my heroes because they walk and they've been called to action, and I think in Western Mass we have really answered the call. We've really done a good job. We have more to do though.
And what are you most looking forward to this year?
October 21st. I'm looking forward to the walk. I mean, it's an honor and a privilege to be a member of the Rays of Hope advisory team, but then to represent the walk with Lucy right here, the founder, walking in memory of my friend Tracy. So to be the 25th anniversary chair, a little pressure. To do something different, but we already had an event, Pink Diamonds and Denim, where we raised some money for Rays of Hope. So we're trying to do some things that are a little special this year, but this is a special year because 25 years later, there's so many advances, and we see the walk getting bigger and bigger, and the bigger the walk gets, then that's indicative of the fact that more folks are in tune and aware of the importance of breast cancer and things that you should do in terms of prevention and the support that's needed around it to continue.
How much money has your organization been able to raise?
Oh, I love saying this. $14.2 million since we started. The first walk we raised $550,000, and we had 500 walkers. And now to think that we have like over 24,000 walkers at the walk, and we raised close to $1 million at the walk. Well, that's always our goal, but the more money we make, the more we can do with our money, the more research we can support, the more support services that we can provide. So it's amazing.
And you said that the focus now for your organization is research. When you say that, explain a little bit more what you mean, where exactly the money goes.
Well, we support the breast cancer, the Rays of Hope Cancer Rays of Hope Center for Breast Cancer Research, and we support local research. And one of the things that I learned early on, I was part of a scientific review panel for the Department of Defense. I learned that in order to get big monies from federal agencies, that you really needed to show support locally, and that's what we do with Rays of Hope. And because we've done that, we've been able to get large grants from NIH and the Department of Defense, and the reason we get them is because they see that Rays of Hope locally is supporting what we're doing here, and that's key to getting these large grants. And with the large grants, we can really make more of an impact. I'm hoping for something coming out of Western Mass that actually is going to make a difference nationally.
I can echo that in terms of the research. So it's very, very competitive to get an NIH grant. But with $25,000 startup funds from Rays of Hope, we were able to get preliminary data. So for example, one of the grants that we have is a $3.5 million grant, just based on that $25,000 investment from Rays of Hope. And that grant is to study estrogen in the environment. One of the things that we have with the Rays of Hope Center for Breast Cancer Research is we have a breast research registry. We now have over 1,000 participants, and that gives us an ability to study what makes cancer different in one person than the next. Why does one person get exposed to something and get cancer and someone else have the same exposures and not get cancer? So there's so many unanswered questions that we really need to drill down on an individual basis.
Okay, and let's talk a little bit now about prevention. So it's obviously a huge component of the organization, trying to prevent more women. What are some of your guidelines?
Well, you know, we mentioned the importance of screening. Screening picks up a cancer early, but it doesn't necessarily prevent a cancer. Healthy lifestyles do matter. I think it's also important to know about your breast density to be able to understand if you're higher risk or not. It's important to know your family history. People were not interested 20, 25 years ago in genetic testing, and now we have the Family Cancer Risk Program at Bay State, and we have a number of people that do want to pursue additional information to see if they have inherited a genetic susceptibility to breast cancer. There are also medications that can potentially reduce the risk of breast cancer. Sadly, they're underutilized. But I think an important message to everyone is that healthy lifestyles do matter. So don't smoke, minimal alcohol, exercise regularly, healthy lifestyle, healthy diet, all of those things do make a difference.
How many women do you have, you don't have to give me an exact number, but that are not going through breast cancer and just want to be involved and get the word out there?
I think almost everyone's been touched by breast cancer, so I think people really come, I mean, people come for different reasons, but I think people just come to support our walk and breast cancer survivors, don't you think?
I think everyone has a family member or a friend.
Someone.
You know, people have been impacted from various degrees, and there are those folks that just want to support a cause that they think is important.
What I like now is I see a lot of young people in the walk, and you know, that just tells you that they want to be involved. I mean, we're doing this for future generations also, so we want to see young folks, we want to see everyone at the walk.
Okay, so let's talk a little bit more about the walk. What day is it, the time, where can you register?
Okay, well, the walk is on October 21st, and we register at 9 o'clock. The actual walk starts at 10:30. The program starts at 9:45, I believe, and there's just massive people there. And so I always say, I'm always there really early, but I try to get there really early if I were you, because it's going to be a really big walk. When you think about it, we actually have to bus people in, so it takes extra time for parking. But the walk starts at 10:30, and I think that's it.
And if you can't walk or you can't make it that day, how can you donate and still get involved in this cause?
You can still go to the Rays of Hope website. And so everyone uses technology. If you just Google Rays of Hope in Springfield, Massachusetts, you'll be able to make donations online. There are so many people that have teams out there. And so if you need to find out about Rays of Hope, there's a number of ways that you can do so. And I know that I'm sure you're going to be providing that information to the listening audience as well.
And volunteers, are you always looking for volunteers?
Yes. Yes.
So that's another way people could get involved.
That's another way you can get involved. We really, we couldn't put this walk on without the volunteers. The volunteers has made us, have all the money that we've raised because they volunteer their time, their resources, their talents, and so we welcome all volunteers.
All right. Thank you all so much for being here today.
Thanks for having us.
When we return, we'll be talking about the breast center at Cooley Dickinson Hospital and the services offered there. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we're talking about breast cancer awareness. Cooley Dickinson Hospital is the major medical provider for Hampshire County and its partners with Massachusetts General Hospital. The breast center opened in 2017 and offers advanced diagnostic and treatment options for breast cancer patients. 22 News and Cooley Dickinson Hospital are partnering in the Go Pink for Breast Cancer Awareness campaign on Monday, October 22nd, when we encourage people to wear pink in support of breast cancer awareness. Joining me now to talk about breast cancer care at Cooley Dickinson Hospital are Dr. Michelle Helms, a breast surgeon with Cooley Dickinson Medical Group, Josie Golden, a breast cancer patient being treated at Mass General Cancer Center at Cooley Dickinson, and Becky Pachalski, a nurse and care coordinator in the Mass General Cancer Center at Cooley Dickinson. Thank you all for being here today.
Thank you.
So first of all, let's talk about the hospital's creation of the breast center. When did that come to be and what services are offered there?
So the breast center opened last July in 2017 and has started as an advanced imaging center for breast patients. So we offer 3D mammography, 3D stereotactic biopsy, and other breast services as well. So since its opening, there's been about 10,000 patients who have been screened and treated through the breast center.
And talk about some of the latest technology. You just mentioned 3D mammography. Are you now pushing most women, or is that dependent on each patient?
So all of our patients are screened with the 3D technology. The way we explain it is that instead of the 2D view, it basically allows the radiologist to look through the whole breast, almost like opening a book and seeing the pages that flow in between. So it has been very successful in reducing the number of additional images a woman might be called back to do if something looks suspicious.
Okay, Josie, you're going through this right now. Talk to us a little bit about your experience and your diagnosis, whatever you're comfortable talking about, and how the breast center has been able to help you through this journey.
So in 2013, I was diagnosed with stage 2 while I was breastfeeding my daughter. So I was very young as ages go, as well as in Seattle, and so it wasn't here that I was originally diagnosed, but it was, I'm sorry, I'm really nervous. And then I got here and I was immediately set up at Cooley Dickinson because I live here, and I got a lot of word of mouth recommendations for Cooley. And Dr. Rockwell and Becky were my initial view into Cooley Dickinson Hospital. And then when I was, in 2016, I was on the way home from Italy and had some massive brain symptoms, went straight into Mass General and had immediate surgery. And so it did metastasize to my brain. And so because I was at Mass General and partners with Cooley Dick, it really made my care seamless. And it was just, everything being what it was really a great way to be treated. And it was just it made it a lot easier for me, all the coordination.
Oh, so 32 years old. Most women aren't getting mammograms till 40, is that correct?
Correct.
So they wouldn't have even caught this had you not have felt it yourself.
Correct.
So what do you say to other women about self-screenings?
In general, I think you have to be your best advocate. You have to stand up and make it known, and you have to do some research by yourself on your own, either with talking with other survivors, talking with other clinicians, And you just have to make sure that your medical team hears you. And at 32, with breastfeeding, there's a lot of other things it could have been. And luckily, my gynecologist that I went to said it's probably nothing, but we'll send you to the ultrasound. And the ultrasound tech said it's probably nothing, but we'll do it anyway. And because they did it and they followed through, I ended up getting caught as quickly as I found it. And so it was impressive, the team that's behind you when you do get diagnosed and the amount of information that's out there, but you really have to make it yours at the same time.
Becky, what has it been like working in now the breast center and having a place dedicated solely for this disease and finding and curing this disease? Oh, I'm sorry. Okay. So working with this organization in general,
yes.
then.
So it's been very nice partnering. You can erase that, right? Yeah, why can't I say the word? Partnering with Mass General and being able to provide the seamless care that Josie talks about. So, images are readily available. We're on the same electronic medical record platform. So, what we're doing at Cooley Dickinson, they're also able to see in Boston at any of the partners' hospitals, actually. So it's really improved and increased communication and been able or provided an opportunity for physicians to communicate pretty readily as well and work together on folks' care.
Yeah, how huge is that relationship? There's often a feeling that Western Massachusetts is kind of left behind on a number of different things. So having this relationship with Boston, does it make some of the cancer patients feel like they've got both ends on their team here?
Absolutely. So, it's nice to be able to have access to clinical trials through Boston, but also, say imaging needs to be done. So, maybe an MRI, maybe a CT scan needs to be done. It can be done here locally, viewed by the folks in Boston, save folks trips out to Boston as well. But there is just such a nice coordinated approach, and everybody has been so wonderful to work with, and there's really a vested interest in everybody that we care for. And we feel very fortunate to be able to have access in this community to, such an amazing resource.
What has the response been to the breast center from patients?
I think the patients love it. It's a warm, welcoming space. It makes women feel comfortable, and I should say men as well, because though the women are more likely to have breast cancer during their lifetimes, men can have breast problems as well and have breast masses and need to be imaged as well. So it's been a really wonderful space to work in, and we're so thankful that that we have it for the community.
And are there different services now being offered that weren't offered before the breast center opened?
So we're constantly updating our technology, and again, in our partnership with Mass General, that's one of the benefits, is we're always trying to be on the cutting edge of what's new in breast care. So recently we updated our stereotactic mammogram machine, which is the one that uses mammogram guidance to take a biopsy of a suspicious spot. And so that's another exciting venture for us at the breast center.
Okay, what about support groups? If a woman wants to get involved and find some support, where do they go? Do they go to the breast center to find some of that information?
So we're still getting a lot of those types of programs off the ground. We refer a lot of our patients to the Cancer Connection across the street.
Yep. So we are huge supporters of Cancer Connection. So they have wonderful resources that are available. They have support groups. They have integrative therapy programs that are available: massage, Reiki, acupuncture, craniosacral work, even therapeutic facials, actually, for both patients and caregivers. So it's nice that it's extended to the caregivers as well. And then there are seasonal courses that folks can participate in: gentle yoga, water aerobics, art classes. So a lot of really nice therapeutic things are available through Cancer Connection, and it's all free of charge, which is incredible that our community has that to offer. At the Mass General Cancer Center at Cooley Dickinson, we also began an integrative oncology therapy program. So in an effort towards stress and anxiety reduction, which most folks who come to see us, unfortunately, have both of those, we offer free massage and free Reiki as well.
All right, we'll continue our conversation after a short break. Stay with us. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're talking about breast cancer awareness and diagnostic and treatment options. So Josie, you shared a little bit about your story and how you became involved with Cooley Dickinson. What advice do you have for other women who have not been diagnosed with breast cancer or maybe just have been?
So I think while most people do know somebody who has been diagnosed, when you do get first diagnosed, it's just a sudden fear that you get. And I know that I experienced that, and I think that everyone kind of tries to be wonderful in telling you that you're going to be okay and you're going to make it through it, but at the end, you just feel really scared. And I know I did both times I was diagnosed. I had a young child. I really want her to know her mom, and so for me to know that that was normal would have been really nice. So if you feel a lot of fear, it's normal, it's okay, and to talk about it. And I know when I was diagnosed with stage 4, I came and talked to Becky, and I hadn't known her for very long, and she really made me feel okay, like I can do this, and hooked me up with a lot of resources, but also was just a great listening ear for me to really kind of pour my heart out. Because that stuff is not easy for anybody to talk about, and certainly not for me. And I mentioned it earlier, but to be your own advocate, getting cancer, you feel really powerless at the, throughout, but certainly at the beginning, it's happening to you. Everybody's throwing things at you. You're having surgery. You're going to have radiation. You're going to have this. You don't know what you have yet. And so to be a part, you are not just a patient, you are a part of the medical team. You need to make your voice heard, what you want, what things are important to you. For me, it was running. Running is kind of my yoga, so for me to keep running through treatment as best as I could was really important. But just feeling like you are a powerful person, taking a little bit of control in a very control-less environment is important, and to do research, not to do everything on the internet, because there's a lot of stuff out there that is really old or isn't even accurate to begin with, but there are a lot of sites. Breastcancer.org was one that I really used that really help you in those nights when you're terrified and awake. And then the other thing is, I really find it helpful to be grateful, and that's kind of one thing I've really stuck on. There are people in worse situations. There's a lot of worse situations of everything out there, and to remember that there are worse situations, to be grateful for what you have, to be grateful for the people in your life that make it worth it, that we're going to help you through it. And you will be stuck in traffic at some point soon again, and you will be upset about it, and to be grateful that you're stuck in traffic and that you're alive, and to live whatever life you have in the way that you want to live it, whatever that is for you, I think is something that I've really attached onto to make it less scary and to calm myself down.
So it's been 2 years since your original diagnosis, or
2 years since my stage 4 diagnosis, yes.
Okay, so at that moment, you probably didn't expect to make it even this far. How has that process been? And here you are now. I mean, you're an inspiration to many women going through this.
Well, so I was in the Army for 10 years, and I was in combat in Iraq for 3.5 or so of that. And it taught me a lot, and it taught me a lot about being, strong, but also, making smart decisions, being calm in really stressful situations. And it did really prepare me to kind of suck for a while. And I hate to say it, but it makes it a little bit easier to understand there is a light at the end of the tunnel, that things will get normal again, and you have been through hard things before, you can do it again. And that strength that it imbued in me was really helpful. And for the last 2 years, my daughter was 5, now she's 7. It just is really, I'm very grateful to be here. I'm here because of a wonderful team of doctors and nurses and caregivers that supported me. I mean, the medical team at MGH that caught me early and got me in there for what I thought was a pinched nerve, saved my life. And every day I just try and pay it back and pay it forward and be there for people that are going through this too, and to let them know that you are in control and you can make it what you want to make it. But it is scary.
So does this go to show the advances in medicine as well? I mean, stage 4 diagnosis 2 years ago, and here she is looking perfectly healthy to the average person.
Sure, absolutely. Breast cancer care has come a long way. When we originally started screening mammograms in the 70s, since then we've seen a 30% decrease in mortality from breast cancer. And Josie is an awesome example of having a will to survive and thankfully having new medicines and ability to treat. Becky can probably speak to that too.
Yeah, so I think that Josie being her own advocate and certainly, making sure that her voice was heard in all of this. She is definitely a self-promoter as far as education and making sure that she is fully informed, and she seeks out the information that she needs from good resources, and we've been able to do different treatments, and thankfully things have been good, and we hope for that for a very long time.
I think too, Josie's story inspires me and reminds me how thankful and grateful I am to do the work we do every day. And we work, Becky can say as well, we work with an amazing team at Cooley Dickinson and with our broader family at Mass General. And breast cancer care is something we individualize to every patient. And I try to stress that to our patients as well, that we walk this walk. You're the boss. We work for you. We want to make you feel that you have the most robust support you possibly can, so that we're grateful to walk alongside of you through your journey.
And there's no one size fits breast cancer, correct? Everyone's treatment looks a lot different. Can you talk a little bit more about that?
It's tailored more to the individual. So, we have tools as, treatment has progressed and research has allowed us to understand that it's not a cookie cutter approach, right? So, we use tools like Oncotype, so it's a risk stratification score that allows us to better determine when chemotherapy is indicated versus when it's not. We have receptors that we look at when it comes to breast cancer, and we can target treating those as well. So there's deep inspiration breast hold try that again. Deep inspiration breath hold technology in our radiation department for left-sided breast cancers that minimizes tissue to adjacent organs. So, we're very fortunate to have come a long way in our treatment and tailoring it to the individual, absolutely.
An interesting statistic from the American Cancer Society, Massachusetts is in the top 10 of states for the breast cancer rate, above the national average. What is it? Is there something about our lifestyle here, or?
So we know a lot of what is associated with breast cancer, and there are probably a lot of environmental factors that we don't necessarily have a hold on quite yet. But we do know that you increase your risk by smoking cigarettes, by drinking an above average amount of alcohol. And then there are certain risks that are related to your exposure to estrogen. So having an early menstrual cycle and having a late menopause can lengthen that estrogen exposure. Also, pregnancies and breastfeeding are actually protective time, so work in your favor as well. And then, of course, family history. Though only 15% of breast cancers are associated with a family history, that's still really important as well.
Okay. Cooley Dickinson Hospital has much to offer patients with any type of cancer. We'll learn a little more after the break. Stay with us. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we've been talking about Breast Cancer Awareness Month and prevention, along with diagnosis and treatment options. So let's talk about some of the prevention methods that you do recommend at Cooley.
Certainly annual screening mammograms we recommend. There's clinical breast exam that can be done by a provider. So if you have a provider that you're comfortable with, whether it's a OBGYN or your primary care provider, or even a surgeon that you follow with doing a clinical breast exam. And then there's also kind of awareness of your own body and doing a breast self-exam at home. Typically about once a month is the frequency with which you should do that. I wouldn't go beyond that, but just really to identify any potential changes. One of the things that we have at the Mass General Cancer Center at Cooley-Dickinson, which is a really nice resource, is we have genetics counseling and genetic testing. And when we have folks that meet a certain criteria, so when folks are diagnosed and they meet criteria for genetic counseling and genetic testing, we have a nice process that's actually a 24-hour turnaround time. So it's called urgent genetic counseling. Oftentimes it will come from Dr. Helms or Dr. Michelson. They have a patient that meets the criteria, and the outcome of genetic testing will impact their surgical decision-making process. So they'll give a call over to us. We'll contact the Mass General genetics counselor, who will then call and do actually an over-the-phone genetics counseling. It's about an hour long on the phone. It's not ideal. We'd prefer it in person, but in the interest of time, it certainly moves things along. And then they come into the Mass General Cancer Center at Cooley-Dickinson. We do a blood draw that's sent out. It takes about 2 weeks to come back. And then that information is helpful in the decision-making process going forward.
So how much are you finding out from these genetic tests, and how much of it seems to be genetics?
So about 15% of breast cancer cases have a genetic component. So the problem is this is still an area of budding research that we're learning a lot about. So we're actually really thankful for our patients who are willing to undergo testing, because that helps contribute to our scientific knowledge of where breast cancer, what genes are contributing to breast cancer, and how we can best treat them.
So right now, because it's still kind of in the early stages, is it just people that have been diagnosed already with cancer that are going through this genetic testing?
So no, we often refer patients who come to us who we consider high risk for breast cancer. So if a patient has a first-degree relative who has had breast cancer, especially at an early age, then that causes us to kind of ring an alarm to say this is something we may want to know going forward.
Okay. All right, what are some other programs that you have for treatment? Let's talk a little bit more about treatment now. So, as we mentioned earlier, each path is different, but what, where does that start?
So we work together as a team, which is something where we really enjoy together. So the radiologists are often the point person for imaging and then for biopsies, because most of our breast cancers are detected before they can be felt. So so it's the mammogram or the ultrasound that drives the biopsy. And then from there, our pathologist looks at the specimen under the microscope and tells us the specifics of the breast cancer for that patient. And often then they meet our team as a whole. But the usual first step in breast cancer care is surgery to remove the tumor, and often to test a lymph node as well, and then to make decisions for further treatment thereafter, which would include the oncology team and our radiation oncology team as well.
So not everyone's treatment involves chemotherapy.
Right.
Does everyone's treatment usually involve surgery?
Yes.
And radiation?
Yes.
Okay.
Yep. That's usually the first starting point.
Okay. Because of some of the advances in medicine, there is an increased rate of survival, as you mentioned earlier. What are some of the advice you have for patients who have beat cancer and going forward with their life after overcoming this?
Survivorship can be a little bit of a tricky time, right? So sometimes folks can feel like my oncology team has been right there through this entire process, and I'm seeing them every 2 weeks, or I'm seeing them monthly, and then those visits get extended out, and sometimes folks can say, well, wait a minute, who's keeping an eye on me, right? So I think being aware of your emotions, being in check with those, having an outlet for stress reduction is important, but also being part of a support group and knowing that those feelings are normal, and that if there's anything that feels abnormal to you on your body, all you have to do is pick up the phone and call your oncologist, and we'll sort it out for you.
Josie, do you feel now that you are able to live a more normal life than when you were originally diagnosed? I'm sure you'll never feel like it's back to what it was, but...
That's a really good question. I feel that some days I go the whole day and I don't even really think about it. And other days it'll just kind of come and go, and I'll have a moment where I'm really back there at the hospital, or, back there, getting the first news. I remember when I was first diagnosed, they told me, I think it is, and I really didn't expect it. And I remember sitting in my car and just almost like I was in shock. I think there's some level of PTSD that is associated with patients, especially if you don't have a lot of experience with it like I didn't. It wasn't in my family. And I think that every day I definitely feel that it's not exactly the same, but I'm keeping up with all my peers. I'm doing the best I can for my daughter. She goes to a million things, and I have the same, complaints and topics as my friends. And just every day, I'm grateful to be here. I'm grateful to be upset that, she leaves me at the open house and I'm running around trying to find her all day. I get to be upset about that and feel good that I'm upset about that. So, but it's also really about trying to help other people. And I think, as Becky said, being a part of a cancer support group, keeping involved in it, even if it's online, it's really helpful just to keep talking to people who are going through the same thing. Even if they are far away, you can still do it.
Do you believe we've gotten closer to a cure than we might have been 20-something years ago?
Yeah, and I think that we always remain hopeful. I mean, with the changes that are occurring regularly, there's a lot of reason to be hopeful.
Absolutely.
Of the cancers you treat at Cooley Dickinson Hospital, is breast cancer the most popular, or up there?
It is, and breast cancer is so prevalent in our society. So 1 in 8 women will have a breast cancer diagnosis throughout their lifetime. So that equates to a 12% risk. So that's a pretty high prevalence. For men, 121 women will be diagnosed for every man. So for that reason, we don't recommend that men have a routine screening because it's just not worthwhile, because it's so not prevalent. So it's about probably 30 to 40% of the cancers that we treat at the hospital are breast related.
Okay, if people want to get more information about your organization, go on to Cooley Dickinson's website.
Yep.
Okay, and they can, you do mammograms in the breast center, correct?
Yes.
So you can make an appointment there.
Yes.
All right, thank you so much for being here.
Thank you.
We'll have the last word for you after the break. Stay with us. You're watching 22 News in Focus. You're watching 22 News in Focus as part of Breast Cancer Awareness Month. Today we've been talking about breast cancer prevention strategies, screening, diagnosis, and treatment options. If you want to learn more about the disease and upcoming fundraisers, Rays of Hope Walk and Run, and Go Pink for breast cancer awareness, you can find all of the links on our website, wwlp.com. That's our program for today. We want to thank our guests for joining us and thank you at home for watching. If you missed any of it, you can watch it in full on our website, wwlp.com. From all of us here at 22 News, we wish you a wonderful Sunday.